Could you comment on the impact of the coronavirus pandemic on mental health more widely? And can pharmacists do anything to help here?
Pretty much worldwide, certainly in industrialized countries, that the COVID has had a major impact on people in general. The incidence of depression has increased. The incidence of suicide attempts have increased. In the United States, the incidence of drug misuse has increased as well. And of course, it's obviously the impact that it's had on healthcare workers in terms of being exposed to the virus and the unbelievable hours they're having to work. And at least in the United States, I don't know if it's the same way in the UK, we have a real shortage of almost everybody because the burnout rate is extremely high. People are dropping out of the workforce because they just can't tolerate it anymore. And I don't think we can overemphasize the impact that COVID has had on children, that they've really missed out on a lot of their socialization and their social development that they get at school and through social organizations and team athletics, and the pressure that is put on parents in terms of trying to do homeschooling. I can't imagine taking a first grader and then trying to learn on Zoom. It's hard enough for college students. I just can't imagine, a first or a second grader, and how difficult that must be for the parents as well.
And finally, what would you say to a young pharmacist who was thinking about a career in psychiatric pharmacy practice?
As I indicated earlier, psychiatric pharmacy is really all about people and working with people and caring with people. We can't draw blood and diagnose patients. We can't do an X-ray and diagnose patients. And we can't look at the severity of illness by putting a blood pressure cuff around somebody's head. It's pretty much all from talking to people and assessing them with their symptoms and their history, and again using rating scales to assist with that. Rating scales are sort of our lab test. They don't make the diagnosis, but it's one piece of data that you can use to make a diagnosis and assess severity. And even though we're on the cusp of biomarkers being available, but pretty much currently they're research tools much more than they are clinical tools. So I think if a pharmacist likes working with people and talking with people, people with severe mental illnesses have challenges with taking their medications. And so, for a community pharmacist, interventions to improve adherence are really, really important. In fact, in the United States, we have some specialty pharmacies that only take care of individuals that have mental illnesses, and they're usually either part of a public mental health clinic or their contract with a public mental health clinic. And in many states in the United States now, including Texas, pharmacists can get reimbursed by the public insurance for giving long-acting antipsychotics by IM injection. And so there are even opportunities from that standpoint. And then for those that want to specialize, they can really do comprehensive medication management in collaboration with a psychiatrist. Sometimes in primary care, but more commonly with a psychiatrist. Except we have a psychiatric pharmacist on our faculty that's co-funded with the medical school, and she spends most of her time with mental health issues and primary care, particularly with people that have chronic pain.
So in fact, there are real opportunities in psychiatry for what you might call the practice of the bread and butter of pharmacy.
Oh yes, yeah, all the way from general practice to specialty practice. And in the United States, the Board of Pharmaceutical Specialties, certifies psychiatric pharmacists as mean at least minimum knowledge qualifications in the area. And of course, there are a number of pharmacists internationally that are board certified in psychiatric pharmacy by BPS, including the UK, Canada, Australia, and Western Europe as well. And also the Middle East as well. The pharmacists in the Middle East countries are very interested in board certification.
And what now for you? You mentioned that you've relinquished the dean position. So does that now leave you with time to pursue other interests?
Right now, I'm working with a nonprofit foundation that's out of New York City, the Reach Institute, whose primary goal is to improve the quality of mental health care in primary care. We don't have enough specialists in the United States to be able to meet all the needs that children have for mental health. And so we're trying to train and support primary care clinicians in providing those services. It's an area that I'm really passionate about, and I actually have more time flexibility now to really sort of devote to the issues in children's mental health. And so I'm very excited about the things that I have the potential to get involved in.
Professor Crismon, thank you very much for sharing with us today your insights into the practice of pharmacy in psychiatry and some of your experiences. For more information about Professor Crismon's work, please visit our website using the link in the description, and be sure to sign up for more news, videos, and journals. For updates straight to your inbox, please follow the link below. And thanks for watching.